Hello dear student, welcome in this topic antifungal agents prepared by myself Arif Khan Pathan, Senior Lecturer, Institute of Pharmacy, Azam Campus, Camp Pune. So first, directly instead of going to the antifungal agent, we'll see what is fungi, what is fungal infection. So fungi are the microorganisms that are distinguished from the algae by lack of photosynthetic ability. It means that the algae will have the photosynthetic activity, but these fungi will lack of this photosynthetic activity. Next, these will differ from the protozoa by lack of the motility and position of the chitinous cell wall. So these protozoa will have the motility, but the fungi will lack of the motility and position of chitinous cell wall. And third, these fungi will differ from the bacteria by the greater size and position of the intracellular structures such as nuclear membrane and mitochondria. So by this way, these fungi or fungi types of microorganisms can be distinguished from algae, from protozoa and from bacteria. So we'll have a distinct feature from these as compared to these microorganisms. The fungi is somewhat different. Next we are talking about the fungal diseases. The diseases which caused by any fungus are known as mycosis. So mycosis will be divided into three groups. That depends: dermatophytosis, that is called a superficial skin infection. Next, candidiasis. So if the fungal infection is related with only superficial skin, so that is called as dermatophytosis. Candidiasis, if the infection is related with the mucous membrane, skin and mucous membrane both, and particularly with the mucous membrane, is called as candidiasis. Next, saprophytic infection or saprophytic fungal infection, in which the fungi got inward into the skin or will penetrate the skin and will enter into the deeper side of the skin. It means that these types of fungal infection is called as saprophytic fungal infection, which invade the skin as shown in the figure. So these all three are the types of fungal infection or called as mycosis, dermatophytosis related with skin, candidiasis, the fungal infection related with the mucous membrane, and saprophytic fungal infection which invade the skin. So next we'll see what is the definition of the antifungal agents. Antifungal agents are the agents which are used in the treatment of fungal infection. Okay, three types of fungal infection just we had seen. So the antifungal agent will use in the treatment of these types of fungal infection. Now as far as the classification of these antifungal agents are concerned, in that first is the synthetic compounds which are purely synthetic. In that first, carboxylic acid and their metallic salt. Example: undecyanic acid, undiconoic acid, or its zinc salt, that is called as zinc undiconoate. Undecyanic acid, actually it's 11 carbon containing fatty acid, unsaturated fatty acid. So basically it's a carboxylic acid. Next, dyes, in that the gentian violet, crystal violet and malachite green. These types of dyes are acting as antifungal agent which have an ability to kill the fungi even though they are dyes, coloring agents. Next, dimidine. For these, the stilbamidine, it is an example, includes the class dimidine which is acting as antifungal agent. Next, phenolic compounds such as salicylic acid. Next, thiocarbonylic acid derivatives such as tolnaphtate. Next, azole. Particularly azole stand for which is a 5-membered ring and which has azam, so nitrogen 5-membered ring. These are called as azoles. So for this, or particularly the imidazoles which has 2 nitrogens at relative position 1 and 3, we know that is an heterocyclic ring, imidazole. So meconazole, cotrimazole, these are the examples of the azole series which are acting as antifungal agents. Next, natural products such as antibiotics which are acting as antifungal agents. In that first, the antibacterial antibiotics, or these are also called as antifungal antibiotics. Griseofulvin, it is an example of the antifungal antibiotics. Next, polyene antifungal antibiotics, it includes tetraene. Tetra stand for 4 and ene stand for the double bonds. It means that these are the polyenes, many double bond containing antifungal antibiotics, but depending on the number of double bond, these antifungal antibiotics can be subcategorized as tetraenes. Tetraenes stand for, will have the 4 double bonds in its structure. Example, nystatin, amphotericin A. Pentaenes, which has the 5 double bonds, that is pentamycin, it is an example of the antibiotic which has a 5 double bonds in a structure called as pentaenes or belongs to pentaenes. Heptaenes, which has a 7 double bonds in their structure, that's why many double bond containing compounds, heptaenes, amphotericin B and hamycins, these are the examples of the drug which are heptaenes. Next, that was all about the definition and classification and introductory part of the antifungal agents. Now next is the compound or the drugs we are dealing. So in that first, that is undecyclinic acid or undeconoic acid. So this is the structure of exactly the structural chemical formula and chemical structure of these undecyclinic acid or undeconoic acid. Basically it is an 11 carbon containing, that is 1 2, these CH2 by 8 means 8 10 and this COH containing 1 means 11 carbon containing and with 1 double bond. Double bond means there is a say unsaturation. So if there is a presence of 1 double bond or unsaturation in the 11 carbon containing carboxylic acid is called as undecyclinic acid. Un stands for unsaturation or the presence of a double bond. So it's an 11 carbon containing unsaturated carboxylic acid which is acting as antifungal agent. Now as far as the physical properties are concerned, the color of these undecyclinic acid is colorless or pale brown. Then it has a characteristic odor, characteristic taste. Nature, if you are talking about, it's a clear liquid. So this is the drug which is liquid in nature, and the solubility includes, it is insoluble in water, because as it is an 11 carbon containing and it's a fatty acid belongs to the fats, means they are insoluble in water. And again we know that if the number of carbon atom increases, the non-polar characteristic increases, which will decreases the water solubility, and that is why the solubility is insoluble in water. Next, the chemical properties, it decolonizes the aqueous solution of potassium permanganate. This is a popular test to check out the unsaturation. So as it contains the unsaturation or the double bond, so this will show a test for unsaturation that it decolonizes the aqueous solution of potassium permanganate. It is neutralized by the sodium hydroxide, will give the sodium undeconoid. Means when it is treated with the sodium hydroxide, now this undecyclinic acid treated with NaOH sodium hydroxide, it will give the sodium salt of undeconoic acid or sodium undeconoid, means simply it will form sodium salt. Next, stability storage. It should be stored in tightly closed light resistance container at temperature between 8 to 15 degrees Celsius, because at the higher temperature will get deteriorated or will get oxidized, and that is why it should be stored between 8 to 15 degrees Celsius. This is the storage instructions for the storage of the undeconoic acid. Next, uses. It is used as topical antifungal agents or fungicidal agents, topically to be applied. Internally used for the treatment of the psoriasis. Now what is psoriasis? The animation is already given, psoriasis, so that you can refer psoriasis. Next, psoriasis in which the formation of the scaled and the dead skin layers is being forming. Say this we compare, this is the normal skin and this is the psoriasis. The skin which is suffered from psoriasis, actually it's an autoimmune disorder in which the antibodies are forming and will destruct the dermis layer of the skin, and the skin become dead and solid and inflamed. So scaled and inflamed skin will be forming in case of psoriasis. The redness will be there. So such type of infection is called as psoriasis. You can see the animation. I had shared the animation in the Moodle. Next, neurodermatitis. So this is the say neurodermatitis, inflammation of the skin and due to the fungal infection and itching. It's called as neurodermatitis. Next, pharmaceutical formulation includes the compound of undecyclinic acid ointment, then zinc undeconoic dusting powder, then Mycota and the Teniafax. These are the brands for this undecyclinic acid. Mycota is a popular brand. Next drug as far as these antifungal agents are concerned, that is tolnaftat. So the structure is not important ones, so only the physical properties we are going to deal, and that is color. Tolnaftate having white color, it has a odorless and tasteless. And as far as we are talking about the nature, it is available in the powder form. It is insoluble again in a water. Storage stability, that it should be stored in tightly closed light-resistance container. As far as the uses are concerned, it is used topically. Antifungal agents, mostly topical formulations are available and applied topically for the topical fungal infection, for prophylaxis and treatment of the ringworms, also for the treatment of the skin infections. Next, pharmaceutical formulations include, mostly it is used in most of all types of formulations, that is tolnaftate topical solutions, then tolnaftate powder, tolnaftate topical aerosol, tolnaftate cream, tolnaftate gel. So this is available mostly widely in the topical formulations such as solution, powder, aerosol, then cream and a gel. Aerosol for the better spraying of the medications on the skin or in the form of mist. So aerosol is effective one on the skin. Now, as far as the brand names are concerned, tolnaftate is available as Tanidal, Multidum, and Mycosis. So these are the particularly the brands available for the tolnaftate. Tolnaftate as a drug, as an antifungal agent. So thank you so much. The other antifungal agents we will see in the next part. Thank you.